So, good day everyone. My name is Betty Miyu Hernandez, first year college from BSN 1D. So, now I'm going to demonstrate to you the administering of medication from Vial. So, the rationale is for us nurses or student nurse to have a knowledge on how to withdraw a medication from Vial. Before I start the procedure, I need to ensure that I follow the 5 rights. The right medication, the right dose, the right time, the right patient, and the right route. So before we start the procedure, we need to check our MAR or the medication administration record or the doctor's order. We need to check the label of the medication against our MAR to ensure that we are preparing the right medication for our patient. So after I ensure that, I need now to perform hand hygiene. So the rationale is for us to avoid the spreading of microorganisms or the cross-contaminations among clients. So after performing hand hygiene, we need now to proceed in preparing the things that we need in administering the medication from Vial. So first, we need our sterile water, our powder vial, our 5cc syringe, our aspirating needle, a clean cotton with alcohol, and that's it. So after the performing of hand hygiene, preparing all the things that we need, now we need to make sure that all the things and medication that we have is correct and it matches up our MAR or the medication administration record or the doctor's order. And if we are clear, and now we can proceed in our medications. Next, we need to get our vial and remove its cup carefully. And clean the top of the vial with a clean cotton. So after cleaning our vial, we need to dispose it in its right disposal. So next, we need to prepare our syringe. We need to remove its original needle and replace its aspirating needle. So after preparing the syringe, we need now to get our powder vial and read its manufacturer direction. So it says here that we need to input here a 3 ml of sterile water. So we need to inject air. At a 3 ml. So now we need to get a 3 ml of sterile water. So we need to inject the vial at the center of our sterile water. Carefully and firmly. So don't forget that in getting a medication or sterile water, it's always in eye level to ensure that we are getting the right amount. So after getting a 3 ml of sterile water, we need now to inject this in our vial. We inject it carefully and firmly at the center of at the top of the vial. So don't forget the eye level. Alright, so after that, we need to remove our needle, our aspirating needle. And return it to its original needle. So after mixing the sterile water and the powder vial, we need now to mix our vial. So the right way of mixing our vial is not shaking it. So the right way is the rotational method or rotational pattern, because if we are shaking it, it can be accumulated. So after mixing our powder vial, if it is reconstituted, we need to write the date and the time that we prepared it. So if it is not reconstituted, and then it is ready to give to or inject to the patient. So let's assume that it is not reconstituted. So now we need to check our MAR to check the amount of the powdered vial that we need to give to the patient. So let's assume that we need to inject a powdered vial at least 2 ml at the patient. So now we need to get a 2 ml at our vial. So now we inject the vial at the center of our vial carefully, and we need to get at least 2 ml. And after getting a 2 ml from our vial, we put the cap of the syringe. After that, after our preparation for our medication, we need now to perform hand hygiene. And now we can proceed to our patient and inject the vial. So that's how I demonstrate to you the administering of medication from vial.